Good noon to everyone. I have the distinction of occupying a position that could link policy development with policy implementation and operationalization at the WHO country office in the Philippines. And I also have the distinction of working with frontline healthcare workers, being the technical officer for mental health and tobacco-free initiative in the WHO country office. So if you would notice, based on this graphical representation of the Philippines, we are 7,100 islands. So that would give you an idea of how disaster-prone the Philippines is. And thank you for the short notice. I apologize. This is really a short presentation that I did. I want to be as concise as possible. And I hope I would be able to give justice to the different organizations working on disaster in the Philippines through this presentation. This is the only loaded slide that I have in my presentation, and this would explain to you how we operationalize the framework previously presented this morning by ISDR. So this is the National Disaster Risk Reduction and Management Framework of the Philippines towards the vision of safer, adaptive, and disaster-resilient Filipino communities towards sustainable development. And if you would notice, based on this framework, that there are 4 thematic areas based on the national law in the Philippines. We have an area on disaster prevention and mitigation, and this area is headed by the Department of Science and Technology. We have an area on disaster preparedness, and the lead agency for this is the Department of Interior and Local Government in the Philippines, together with the local government units. We have an area on disaster response, and the lead agency for this is the Department of Social Welfare and Development. And we have an area on disaster rehabilitation and recovery, and the lead agency for this is the National Economic and Development Authority of the Philippines. So if you would notice, the Department of Health is not a lead agency. Why? Because the Department of Health is working in almost all areas, on all 4 thematic areas. So I will be focusing on the lessons learned, and these are not best practices so far. These are just good practices because there is still room for improvement until we make good better and then better best. So according to the World Risk Report of 2011, as you would know by now, the Philippines ranked 3rd and is among the most disaster risk countries worldwide. We rank 3rd because as far as geology and geography is concerned, the Philippines is prone to floods, to typhoons, to storm surges, to earthquakes, volcanic eruptions, and of course, there are also human-induced disasters in the Philippines. One of the lessons that we learn out of the Philippines being prone to disaster is that these are opportunities for the country to test the plans on risk reduction. So we test the existing plans, and then we make as consequent modification or enhancement of the plans. And included in the plans are the policies that we have in the Philippines, like policies on mental health, policies on disability as well. Those are opportunities to review those types of policies. And I would say that we have pretty much good experience on resilience on the ground. The Filipinos are basically resilient because of those different disasters that we experience. And it seems that Filipinos have positive coping mechanisms. There seems to be close family ties and also religion, being Catholic, that gives them a positive coping strategy. And also one of the lessons that we learned from the disasters is that although mental health morbidity is high, disasters create the opportunity for us to create those different mental health conditions. Disasters would provide opportunity to implement mental health system, and as a consequence of those disasters, we were able to enhance specifically the preventive measures and also the access to medicines. And also, as far as the Philippines is concerned, the early efforts on mental health began in the early 1990s. So we created this National Task Force on Mental Health and Disaster Management, and that was during the time of the eruption of Mount Pinatubo. And this task force also had the opportunity to work in areas in the Philippines affected by different types of disasters like earthquake, typhoons, mudslide, storm surges. Another lesson that we learned is that the Department of Social Welfare and Development working with the Department of Health is a key. Department of Social Welfare and Development is the government agency in charge of disaster response, and the Department of Health takes care of the mental health of those responding to the different types of disasters. So there should be a good collaboration specifically between these two agencies and also in collaboration with other government agencies as well. And when we talk of the Super Typhoon Haiyan, which I guess is the strongest typhoon ever to affect the whole of the globe, we had the opportunity to create clusters on mental health and psychosocial support services, in addition to health cluster, livelihood cluster, water, sanitation, and hygiene cluster, social protection clusters. We were able to activate all those different types of clusters. And these clusters consist of civil society, academe, UN, and other government agencies. So there's really a close collaboration among different stakeholders as an aftermath of the Super Typhoon Haiyan. And also, since there's ground zero in areas affected by the Super Typhoon, WHO had the opportunity to implement our Building Back Better initiative. It's like starting from scratch. We had the opportunity to develop an ideal health systems development, although we cannot call it still ideal, but at least it gave us an opportunity to put into application whatever theories that we have as far as our concept of Building Back Better initiatives is concerned. And another lesson that we learned is the smallest functional unit of society, which we call local government units or villages in the Philippines, they really play a major role in disaster preparedness and response. So as much as possible, we should build the capacity of these local government units in all thematic areas of disasters. And also we noticed that coordination across agencies is crucial. So when we say agencies, these include both government agencies, both the civil society and academia as well, international and national agencies. So it also gave us an opportunity to review our policy on receiving foreign assistance and foreign support, and also our policy in the conduct of, for example, medical missions in the Philippines, among others. And another lesson that we learned is since in ground zero, there are no longer existing health workers. We need to retrain health workers. We need to reorganize them. And we need to have them trained on mental health care and community-based rehabilitation services. So our training on mental health, as was mentioned this morning by Mark, we have training on provision of psychosocial interventions. We have training on mental health gap action program or MHGAP, where we train non-specialists to be specialized in providing mental health care, neurological care, and substance use care. And another lesson that we learned is the partnership between the public sector and the private sector is very crucial in almost all thematic areas, but specifically in disaster prevention and mitigation and in disaster rehabilitation and recovery. That is very crucial. And this is my last slide, the key messages that we have learned in all the disasters, the string of disasters that we have experienced so far. Disasters create opportunities for the government to consider mental health care as a priority. Unfortunately, we have to wait for disasters in order for the government to realize that this should be one of the priority programs. Major gaps still remain to implement community-based mental health care because mental health care in the Philippines is largely facility-based. We have yet to implement meaningful community-based mental health care initiatives. And during the aftermath of the Super Typhoon Haiyan, we were able to do pilot testing of how an ideal community-based mental health care should be. And lastly, in the aftermath of disasters, there seems to be an acceleration of the implementation of mental health reforms. So when we say mental health reforms, as much as possible, we want to remove the stigma. We want to demystify the stigma attached to mental health care conditions. We want to move from punitive to rights-based approaches. We want to move from facility-based to community-based treatment of those different mental health conditions. So I enjoin you all to visit the Philippines someday because as you would notice in our tourism tag, there's more fun in the Philippines. Thank you very much for this opportunity.